Thank you so much, Dr. Banas. That was a perfect way to kind of start off by laying the groundwork of what's going on here in California. I know a lot of us are very aware of the mass incarceration and racial disparities, but it's really nice to connect that to the marijuana issue. So next, I'm extremely excited to introduce Representative Jonathan Singer from the Colorado State House of Representatives. Representative Singer, I'm not going to read your bio, I'm just going to say this. Representative Singer has been an absolute champion on this issue. We really don't get to see a lot of state representation talking about controversial issues like this and really working extremely hard to ensure that we are following these evidence-based policies and not these ideological assumptions about tax and regulate and public health and safety. So I'd like to invite Representative Singer, who's going to be talking about preventing public health problems in the context of legalization and give us some information about what's going on in Colorado. Thank you, Representative Singer.
Thank you, Amanda, and thanks for everyone for being here. And as a lawmaker, we just are known for our ability to continue talking, so I'm going to do that. I am State Representative Jonathan Singer. I represent Longmont Lions and Allens Park in Colorado. So this is about an hour north of Denver, and then if you go about an hour west, so everywhere from basically the suburbs to Rocky Mountain National Park. And so when I say it's great to be here, I really mean it because it's about 8 degrees in Colorado right now. And so it really is a pleasure to be here. If someone had told me 3 years ago, sitting in a child protection office where I was working as a social worker, that within another 2 years I would be serving at the state capitol as a state representative, and by the end of my second year would have introduced and passed a statewide tax increase in the state of Colorado on legal marijuana, I might have asked what they were smoking. But the truth of the matter is, here we are. And at the end of 2012, we actually have a number of successes that I was hoping to show you. Starting in 2012, we had a ballot initiative that was being introduced called Amendment 64. And I was working on debate over the marijuana DUI legislation, and at the time actually supported a DUI limit for marijuana. And after that bill passed, after that bill passed the House, it didn't pass the Senate that year, the proponents of that DUI limit said, "Hey, do you want to come out for a drink with us?" And so the irony was not lost on me, but I said, "No, actually, I want to go sit with the opponents of this bill because I want to be just as accountable to them as anybody else and really hear what they have to say, even though we've already taken our final vote in the House." And they were working on something called Amendment 64, and so one of them goes, "Well, Jonathan, what do you think? Is this working for you as a social worker? Is keeping this drug federally illegal and statewide illegal really helping you protect kids?" And the answer was no. And the way that child protection workers work with drugs is we deal with behaviors associated with that drug use. So I don't care whether it's OxyContin, alcohol, marijuana, or cocaine. What I care about is what your behaviors as a parent are when and if you're using those substances, and how that relates to you being a safe parent. So they said, well, that sounds great. Thanks for getting on your soapbox. Will you support Amendment 64? And so I took a while, I looked at it, and lo and behold, I supported it. Little did I know that there were only 2 state lawmakers in the state of Colorado that publicly supported Amendment 64 out of 100. So I'm a Boulder County progressive, and the other person is a Broomfield Tea Party Republican. And so now we're friends on Facebook. It brought us together. It's certainly one Republican in the room. That's good. No. And so when you have 100 state lawmakers, and only 2% of them agree with something, and over 55% of the state of Colorado also agree with that concept. You've got a bit of a dichotomy. You've got a bit of a paradigm shift. And when I came back to the Capitol after that election, My Tea Party Republican friend was actually term limited, and so he was no longer there. So I was the only state lawmaker that had gone on the record saying that we need to regulate this similar to alcohol. And so a lot of times in politics, I tell people that you can't wait for someone to invite you to the table. You need to pull up a chair. Well, the truth of the matter is that the activists and the grassroots individuals that passed this constitutional amendment gave me the chair right away, and they said, well, we got to regulate this thing now. Are you going to help with that? And I go, well, I guess so, because everybody else seemed hell-bent on repealing it in the first place. So there began a journey which was ironically fashioned. It was called the Joint Select Committee on Amendment 64, which the media affectionately dubbed the Joint Committee. And we only had a few recommendations to look at. It was probably only the size of one phone book instead of two, about how we would regulate this previously unregulated market. Well, it was regulated, but regulated in terms of putting people in jail. Very simple, but pretty inefficient. And so what we had to look at were, what's the licensing issues? How do you work within a framework where you treat it similar to alcohol if alcohol was federally illegal? That's not an easy thing to do. Secondly, how do we look at issues related to banking? So we didn't, honestly, in the first year, we didn't even get to the banking issue because we were trying to tackle how we were going to ramp up this regulated market as quickly as possible. And last but not least, when Amendment 64 passed, there was no tax on marijuana. And so it was almost a two-part question that we were having to ask. So within the last 13 days of session, we passed about 4 bills creating a regulated market and putting a question to the voters as to what the tax should be. Lawmakers are not able to raise taxes in Colorado. So as we were looking at taxes, we had to actually go back to the voters and figure out how we were going to do this. That's what makes this kind of unique in Colorado, is that our mechanisms are very driven by the grassroots, and that can be a good thing. It can be a bad thing. It really isn't one or the other. But what it does is it puts this into the public purview in a way that doesn't necessarily happen in other states. Our Constitution is actually riddled with all kinds of things. We have everything from chaining our minimum wage to the Consumer Price Index to, well, it's actually unconstitutional to detonate a nuclear device. So if you have one in Colorado, please don't detonate it. You'll be violating the Constitution. But this is honestly, it's been one of the safeguards. And so I'll quickly go through these slides as I've summarized a lot of these things. Historically, we fortunately did have medical marijuana in Colorado prior to retail marijuana. It's not the way I would have done things, actually. I would have liked to seen both roll out at the same time. But what it did is it actually created an easier on-ramp, because not only did we have medical marijuana, but we actually created a regulated medical marijuana market with dispensaries back in 2010, 2011, and it proliferated to the point where, well, I still have spelling errors here, but as you get the point, dispensaries were actually outnumbering the number of Starbucks in the city of Denver by 2011. Amendment 64 also, Barack Obama got about 54% of the vote. Amendment 64 got a little bit more. It may actually be the most popular statewide initiative ever, and we've got the numbers to prove it. In liberal Boulder County, carried 66% of the vote. In El Paso County, which is kind of our conservative counterpart and home of the focus on the family, it passed by about 10 votes. Didn't get 10 votes, it passed by 10 votes. So now, our governor is not a big fan of marijuana, and his big line after 2012 was, "Don't break out the Cheetos and Goldfish just yet." But he also recognized the importance of doing this right. So when Amendment 64 passed, we actually hadn't decriminalized anything, because you've got to wait from November till about January for these things to be enacted. And so instead of a big enactment day at about 3 p.m. on a Thursday, the governor said, okay, Executive Order 12-004, marijuana is now decriminalized. And so the sky didn't fall. The sky didn't turn into a brown cloud either. And our state flag has remained unchanged, much to the disappointment of some people. So like I said, we faced a lot of recommendations. We had a lot of different groups really come to the table, and I really give our state and our governor a lot of credit for saying at the very tip of the iceberg, before we even introduce any legislation, we want drug policy experts, medical officials, the people that didn't support this in the first place, concerned moms and dads, psychologists, psychiatrists, liquor enforcement experts. We want you all to come to the table, bring your knowledge, bring your expertise. Let's see how close we can get with recommendations. And so this task force got together, and they only had 58 recommendations in 17 categories, so pretty simple. It was a huge, heavy lift and heavy load, and those task force recommendations are actually still available online on our state website. So if you're ever finding yourself nodding off one day or need to create an excellent PowerPoint presentation, you can start from there. What that joint committee did was actually rehashed what that task force was put together. They took together the joint committee. It had to be called that because half the members were from the House and half were from the Senate. Really took into account everything that was going on. They looked at everything from the educational needs to the licensing issues to the public health. And what we did is we ended up creating 4 bills out of that. And the good news is we didn't have to meet on Saturdays. Sometimes it felt like it. We did miss the opening day of the Colorado Rockies baseball team. There you can see me kind of sitting in a legislative session while the rest of my lawmaker friends walked down the street to enjoy something. Our events were certainly no walk in the park, though. We really had a couple guiding principles out of this joint committee, and I think this is important to talk about before we even look at the public health aspects of this. But how do we promote the health and safety and the well-being of Colorado's youth? I mean, that was really the common denominator. But also, how do we do efficient and effective regulation? If we over-regulate, we have the risk of allowing the black market that is thriving to continue. If we under-regulate, we also basically create a legalized black market. So, and last but not least, how do we create a sufficient and predictable funding mechanism to assure that we can support our enforcement scheme? So we had a number of recommendations that were actually consensus. These were bipartisan. We had Democrats and Republicans that came together unanimously to support a majority of these recommendations. Only 24 of them. I won't go through all 24, but everything dealing with how do we regulate concentrates and make sure that we don't have flammable gas just kind of floating out there without the fire department doing effective inspections. How do we deal with minor in possession, and do we make it parallel now to alcohol, which is what we did? How do we make sure that police officers get roadside training? A DUI with alcohol, those behaviors look very different from a DUI with marijuana. How do we make sure that we have consistent training so people aren't inappropriately being flagged? And we also followed our own Clean Indoor Air Act. So just like you can't smoke a cigarette in a theater, you can't be smoking marijuana in a theater. Same thing with open containers. You can't walk down the street carrying a bottle of beer most places. Same thing here, you couldn't walk down the street lighting a joint. And last but not least here was really looking at laboratory testing and making sure that consumers a consistent, safe product. Believe it or not, 2 years ago, this also made the headlines and doesn't seem to stop making the headlines. There you can actually see me 2 years ago. I also had hair. This is what this will do to you. This is your brain. This is your brain on marijuana legislation is what I tell people. But House Bill 1317 were part of our majority recommendations. So we had consensus recommendations, and then the majority of the joint committee suggested several other components. How do we move to state licensing? Fortunately, we had a medical marijuana enforcement division, so we just converted that to a marijuana enforcement division. Question came up about tourism and pot tourism. Do we sell someone from out of state an ounce of marijuana just like we sell someone from inside the state? The answer is no. You have to deal with a quarter ounce and then walk down the street to the next dispensary. Do we create a funding mechanism that exists? And so now, believe it or not, in our own state, we have something called a marijuana cash fund. It sounds like something out of the black market, but it really does exist. Medical marijuana dispensaries came to the table and said, look, we know how to do this. We've been doing it for years now. Give us the first opportunity to apply for recreational licenses before anybody else. And so they got first crack at this. Now other industries and other individuals are able to step up to the plate and bring this industry forward if they want to. But originally we wanted to create an easy on-ramp because actually Amendment 64 created a very quick timeline for us to implement all of these things. House Bill 1318, my favorite one, because it's taxes and I'm a Democrat. No, but I think what's important to point out here is that, in fact, even though a vast majority of the state of Colorado in a record turnout year said, legalize this, do the right thing, get this out of the criminal market, our lawmakers saw it a different way. And the state Senate, which I'm fortunately not a part of, decided that they would create their own version of a tax. And so I had my own statutory tax bill. It wasn't going to go into the Constitution, simple concept. Well, the Senate said, well, have we got a deal for you, Representative Singer? What if we just ask the voters 2 questions instead of 1? Because, if we don't pass your tax, we're going to have to take the cost of regulating this market out of education, out of public safety, out of roads and bridges. Colorado, by constitutional amendment, has to have a balanced budget, Representative Singer. So, if you don't pass this, how are we going to do this? Because Amendment 64 still says we have to have a legalized, regulated market. So the compromise that was proposed to me, I probably should have put that in air quotes, was that we would ask the voters 2 questions. 1, should there be a tax on marijuana? 2, if the tax fails, should we repeal Amendment 64? Yeah, real simple. And they introduced this amendment about 3 days before the end of session, and were waiting for my bill to come over to the Senate so they could kill it, because timelines say that you have to have at least 3 days to pass a bill. And so they were waiting to kill my bill, introduce their own version of it, and then have that be the de facto one because there could be nothing else. So there are some West Wing moments even at the Capitol, and this wasn't Democrat-Republican. This was the Democratic president of the Senate and the Republican minority leader of the Senate came together with this supposed compromise. And so now we were successful in defeating them in this. We called them out before they could execute their plan. And obviously the media got a picture of about half the Senate crammed into one room trying to figure out what to do with Representative Singer's bill. But at the end of the day, this is less indicative of the story and more indicative of the fact that there are still people out there that are willing to repeal something less than a year after it actually even passed. So House Bill 1318 was the tax on marijuana. And one of the things, because in Colorado, the state lawmakers do not have the ability to raise taxes on people, what we did is it actually created tax caps. And we said, should there be an up to 15% excise tax and up to 10% sales tax in the first year on regulated recreational marijuana? What that tax cap does is it actually allows the lawmakers to lower it to 0, raise it up to 1% the next year or 5% the year after that. Because the truth of the matter is nobody actually knows what the appropriate tax rate is. We don't know what the market's going to look like until we actually have a market. It was originally assumed that we would raise close to $70 million in taxes. And the truth is the number is closer to about $20 or $30 million. Now, the good news is it did pass. It has a 77% approval rating, but only passed with about 55% of the vote, which is about the same percentage that Amendment 64 passed by. And what it did is it actually dedicated the first 40 million of the excise to school construction. And I know a lot of people talk about, where should the money go? That was actually part of Amendment 64. It said the first 40 million had to go to school construction. The remainder of that goes into that marijuana cash fund. So we figured it all out. We're done. Okay, maybe not. So in 2014, we had only about 20 bills on marijuana, everything with how to spend the money to how to deal with issues like edibles and banking. So the first bill that we dealt with was Senate Bill 215 to talk about how to spend some of this marijuana money. So as you can see, just a couple ideas out there. But really, it deals with a lot of the things that the doctor just mentioned earlier. Making sure that there are school-based education programs that are evidence-based. Making sure that not only grant dollars are available for that, but when there are substance abuse disorders, that there is money to deal with that. Making sure that there's somebody in the executive branch that can coordinate medical marijuana versus recreational marijuana and move forward in a responsible way. Next, we dealt with labeling and packaging. We wanted to make sure that if you have edible marijuana, which a lot of times in Colorado looks like gummy bears or cookies or things that kids might put in their mouth, that it's put in an opaque resealable package that's child-proof. Making sure that clarifying when the voters said we want 1 ounce of marijuana, that they were not talking about 1 ounce of concentrate, which you're talking about changing the equivalent of a 6-pack or a 32-pack of beer to now what's ostensibly a keg of marijuana. So making sure we have equivalencies between concentrates and the smokable flower. And also making sure that there's adequate product identification. So at the end of the day, we haven't figured this one out yet, but I want to know the difference between a marijuana cookie and an Oreo cookie just by looking at it. And make sure that 5- and 6-year-olds know what they're putting in their body. Unfortunately, on the packaging, we were trying to create a universal symbol. This is one of our failings. The universal symbol for a marijuana product is that. Because that looks like marijuana, folks, right? Kids will stay away from something that looks like a badge. Well, so we're redoing that one among many other things. But real quickly here, and I apologize for the technical difficulties, the good news is, traffic fatalities have gone down in Colorado. Yeah, we can clap for that one. People argue that marijuana DUIs have gone up, and the truth is we only started tracking those recently. And the question is, and I don't have the answer to this, but the question is, are people choosing to stay at home and use marijuana as opposed to go out to the bars and drink? And I will tell you, on January 1st, when we had the first legalized sales of marijuana, I was actually on December 31st driving through Denver at about 11:30 at night and saw quite a few police cars lined up at quite a few alcohol dispensaries, you might call them, or bars. On January 1 at about 9 in the morning, you saw the longest lines since Black Friday, but also some of the friendliest lines, and not a single arrest that day. So we can talk about teen use, and I know this is a little small to see, but actually one of the important things that was mentioned is when the perception of risk goes down, use typically goes up. The truth of the matter is, so far, according to CDC research, Colorado youth use of marijuana is actually either staying stagnant or slightly declining since the legalization of marijuana. I don't know why. I think it's too early to say because we only had our first legal sales on January 1st. But we're looking at promising initial data. Does that mean that we stop now? No. What it means is that we need to start looking forward to certain things. First of all, with taxes in Colorado, because of constitutional amendments, we actually may be returning the $20 million we raised from marijuana taxes directly back to the taxpayers again through conflicting constitutional amendments. But assuming we can avoid that, some of the things that we need to start looking at is after-school programming. The National Youth Violence Prevention Center states that actually 9 out of 10 American kids should have access to after-school programs, but about 2/3 of parents say they have a hard time finding them. If you want to talk about something that's popular, something that people are willing to put their tax dollars behind, and the truth is after-school hours are the peak time for juvenile crimes and risky behaviors, whether it's alcohol and drug. My conservative friends talking about premarital sexual activity. You know, if you kids have somewhere to go, they'll go there. If they don't, they'll find their own things to do. Colorado is also unfortunately one of the has one of the highest rates of drug addiction in the nation. And part of that is because of our historical lack of funding for addiction services. It has nothing to do with the legalization of marijuana, but that doesn't mean we can't be on guard for this. And if we have a new funding stream, we can take advantage of the fact that Medicaid doesn't pay for things like inpatient treatment most of the time. If you're middle class, your health coverage is probably not going to pay for you to go to an inpatient treatment facility. So we can start now actually putting these things into place. And last but not least, we've got more marijuana funds to come. We've talked about the marijuana rollout and hashing out issues. 70 years ago, we legalized alcohol, got rid of prohibition. We had about 7 or 8 alcohol-related bills last year. So this isn't going to end anytime soon. We're going to continue to look at new legislation to continue to adjust and readjust. You know, Colorado blazes its own trail with these things, and I look forward. It's told you it's never ending. But I look forward to seeing and hearing from the rest of the presenters here, because we've got a long road ahead of us. Colorado has certainly struck the right note and started out on the right path, but we know we can do better. We are all petri dishes here, and I can't wait to see what else we have to come. Thanks for your time.